This video is to determine if your hip is causing some of your low back pain. So we're going to go over 3 tests today that you can do at home to determine that. So what we're going to do is we're going to start with the first one. So you're going to be laying on your back and you're going to bring your ankle to your opposite leg and you're going to let your knee drop. And what we want to see is we don't want to have the opposite hip come off the table, and you want this leg parallel to the ground. If this leg is not parallel to the ground, such as mine, then you're lacking a little hip mobility. If it's causing pain and pinching at the hip, again, it's hip mobility. And if it's reproducing your low back pain, then it's likely contributing to your low back pain. The next one is that you're going to bring your knee in, bring your knee across the body, and take your knee out away, and you're just going to bring it across. Again, we're looking for pain or pinching at the hips or reproduction of that back pain. And then the last one is you're just going to bring your knee to chest, and you want at least 90 degrees of hip flexion before your pelvis comes off the ground or off the table. And if you get pain or pinching here before 90 degrees, then it's likely you're lacking hip mobility, but it also reproduces your low back pain, then it's clear that the hip is contributing to your low back pain. So ideally you'll get 120 degrees of hip flexion, and then again you're going to want your leg parallel, and then here we're just looking for reproduction of pain in the back or hip. And those are your 3 hip tests to determine if the hips are contributing to your low back pain. In the next video, we're going to do 3 at-home tests to determine if the primary source of your low back pain is coming from the spine itself.